More than 1.3 million Americans are living in nursing facilities. Unfortunately, these residents are particularly vulnerable to COVID-19. Since in-person visits are not permitted and because some facilities are not prioritizing virtual visitations, some families feel left out in the dark about the health of their loved ones. Elaine Ryan, AARP's Vice President of State Advocacy, is here to share vital advice for those with family members in nursing homes. Thank you, Elaine, for joining us. We do appreciate it. Let's get to a question for you. Recent numbers from the California Department of Public Health show about 40% of COVID-19 related deaths in the state were residents in elder care facilities. For elderly people right now, is this the safest spot for them?
Well, I think for many people, they may not have a choice. The nursing homes, as you know, are homes to some of the most vulnerable Americans who need special help and medical help. And at the same time, we know that COVID-19 is spreading rapidly through nursing homes, and more needs to be done to protect those residents.
Many families are feeling, very helpless. How can they help their loved ones in these facilities? What can they do in the meantime?
Well, since you noted that visitors are banned from even visiting their loved ones, here are a couple of words of advice that we would offer. I'm sure if you have a loved one in a facility, you've always been an advocate. This is the time to raise your voice once again. So we're suggesting that you call the facility. You ask them whether or not they have COVID-19 cases. You ask them whether or not they have infection controls in place. You ask them whether they have adequate staff. You ask them whether or not those staff have adequate protective equipment to do their jobs. You ask for the ability for a daily visit, a telephone call, FaceTime, something with the loved one you have in those facilities. And you ask them what is their plan to keep you continually informed about what's going on in those facilities.
So let's say, for example, I have my grandmother who's in a facility. I hear the facility does have COVID-19. Would you say that I could go in there and get her out of there, take her home for a couple of months until this settles down a little bit? Are people doing that?
Well, I would say that if you know that your loved one has COVID-19 in a nursing home, your first question needs to be to that nursing home to say, what are they doing to help your loved one? Because you know that those needs may be immediate. So the protection of your loved one should be job one. Second, I think as people are thinking about whether or not they should remove someone from a nursing home, they need to consider a couple of key points. One, ask yourself, could you care for your mom or your grandmom at home by yourself? Do you need extra help to do so? Will that be sufficient to meet her needs? And also, you need to be aware that many people in nursing homes have their medical care coverage through Medicaid or Medi-Cal. And so by removing that loved one from the nursing home, you might be jeopardizing their ability for ongoing medical assistance. So these are critical questions you need to sort out, and you need to be careful in making those decisions, because once you've taken someone out of a nursing home, you may not be able to get them back into that nursing home.
And those are all good points, especially with insurance coverage. You may be discontinuing that or certainly stopping that. Next text coming in for Elaine is, what are nursing homes doing to prevent infections? I mean, to prevent and to deal with deep cleaning daily. What are you hearing?
Well, I will say that unfortunately, since we know that 10,000 Americans have lost their lives in nursing homes, I guess the answer at one point is not nearly enough. So some states are doing things like calling in the National Guard to create a regimen of inspection. Other states are doing ongoing testing. Some are doing increased pay for the staff who work in those nursing homes because they are at risk themselves, so states are giving them hazard pay. We also know some states are helping with this virtual visitation so that people can stay in contact with their loved ones during this unprecedented outbreak. So we need to be doing more. We need to be doing much more because we don't have another 10,000 lives to endanger or to lose in this country.
Elaine Ryan with AARP, Vice President of State Advocacy. Elaine, thank you for your time. Appreciate all that good feedback.
Thank you so much.